A Dementia Enhanced Prevention and Care Program of Activity was set up in 2014 to try and look at how we could improve dementia care diagnosis and how we could screen people early to make sure we picked up cases earlier rather than later in the dementia disease. So we are looking for more cost-effective ways to pick up dementia earlier and to try and get people diagnosed earlier so that they can access medical services, which will hopefully reduce the progression of disease and allow them to live more fulfilling lives for longer, independently. So our study has been primarily focused in Selangor, where majority of services are located, to try and get an overview of how they find accessing dementia care pathways and whether they know where to refer patients and what treatments they can provide for these patients. Because although there are guidelines available in Malaysia about how to try and do optimum care, if those facilities aren't available in the location where those people are living and working, the patients aren't necessarily going to receive those services. It's a very important disease, and is because we have an aging population, and the proportion of elderly people in the future is going to be much higher. As a consequence, a number of those will have dementia. So whatever provision we have for services and care now isn't going to be sufficient in the future because people are living longer. And if people are living longer, they've got to be looked after. So it's about how can we improve the quality of life for people if it's inevitable that some of these people will get dementia, and how do we support families or carers to be able to look after them and recognize symptoms early so that these interventions, whether they be pharmacological stroke drug interventions or whether they be things like cognitive stimulation therapy, they want to be able to give those earlier rather than later to try and prolong memory, language and behavior. All of them are required to go and do a final year project, which historically they've gone to the UK to do, but this year we're going to allow some of them to stay here and do projects with us here. Another opportunity is that they can undertake a summer research fellowship, and we have about 4 of our faculty who supervise students doing a project over the summer. We've also had medical students doing projects. They've got publications out of it, they've given talks at conferences. It's something they've been able to use to get their research positions when they've left because they've already got some experience. For the BMS students particularly, the majority of them will try and take up the summer internship or go to the UK or go elsewhere and do their projects. There is another opportunity is that we've started employing some of our graduate BMS students to work on the projects with us. So they're working on funded projects. So we've had about 4 or 5 BMS students who've come to work with us as graduates, and it's been their first research job after they've finished university. Thank you for having me and giving me the opportunity to talk to you today about the work we're doing at NewMed in relation to dementia. And I very much hope in the future we're able to share some of our findings with you all, and you can perhaps help with some of these projects in the future.